In this standard, we'll pick up around the 8th week of development and go all the way through and including the process of birth. The FETUS.3 standard reads, I can describe the fetal stage of prenatal development, including birth. So, last time we said there are two main stages of pregnancy. We had the embryonic stage, where we went from one fertilized egg cell and we differentiated and we grew and we divided very rapidly and formed most of our internal organs, most of our external structures, and now we're going to transition over into the fetal stage of development. So we ended right here, very large head. During the fetal stage, we'll cover weeks 8 through 38, and we'll see really rapid growth, rapid weight gain, and a change in body proportions. We will continue to see a change in body proportions as we transition through development and through like adolescence and puberty, but it'll be very apparent through the fetal stage. We'll also see our reproductive organs distinguished and a continual development of the nervous system. I have a picture of the reproductive organs here. So in this first picture, we see some primitive tissue that is capable of differentiating into male or female. So for instance, this pink portion could either become the glans penis or it could become the clitoris. This orange-red portion on the side will either develop into the scrotum or into the labia. So we have tissues that, depending on the effects of hormones, will form radically different structures and determine our biological sex. Weeks 9 through 12, so these first few weeks of fetal development, we're going to see ossification really appear in bones. So in our embryo, we just had cartilage models of bones. They were hyaline cartilage models, but now we're going to see osteoblasts start to really lay down true bone tissue. We'll see that differentiation of sex organs. So in the first 8 weeks, there's really no visual difference between male and female embryos, but at this point, we'll start to see differentiation, and we can usually determine sex on ultrasound around week 20 or so. And we'll start to see little movement. So nerves and muscles will begin to coordinate and allow for the movement of limbs. You may feel some very small kicks as the fetus begins to move around. Right now, we're about 2 inches long and half an ounce. So very, very, very small stuff. From weeks 13 to 16, our bodies grow rapidly. We continue to lay down more and more bone. We grow to a length of 4.5 inches or so and weigh 3.5 ounces. So we have increased our weight by 7-fold in just 1 more month. Weeks 17 through 20, we'll see really strong muscular movements, and so this is when women truly begin to identify kicks that they can feel externally, and the skin is covered in these fine hairs called lanugo. This lanugo will usually be shed a little bit after birth. Babies come out a lot hairier than they end up being, but they're just preliminary fine hairs. We're looking at 6.5 inches and 10.5 ounces. Then for the entire second half of the pregnancy, weeks 21 through 38, which is usually about the limit of life if you give birth prematurely. If you give birth around 20 weeks, that fetus will not survive. If it's around 22 or 23, it might survive with intense interventions, particularly for the lungs, because during this time, we're not only going to see weight gain and subcutaneous fat deposits and eyebrows and eyelashes, we're going to see lung development. We may see testes descend a little bit in males during this period, making it a lot easier to discern sex on an ultrasound. And we grow to about 19.6 inches and weigh 6 to 10 pounds at the end of those 38 to 40 weeks when we are fully developed. The last 3 months of this pregnancy are usually all about weight gain, just depositing that subcutaneous fat and having these reserves for the baby. A note on some things that happen due to the mother's body during pregnancy. we see a real displacement of abdominal organs. It's very obvious when a woman is far along in her pregnancy. So there's pressure on her stomach. We might see her not able to eat as large of a meal in one sitting. We see more frequent urination as that head pushes down on her bladder. And a larger fetus means we're going to get more waste passed across that umbilical cord and across that placenta into the mother's body. So her heart rate will increase, her breathing rate will increase, her blood volume will increase because she's doing the job of a body and a baby body. During this time, mom has to make sure she gets adequate nutrition because she is building a body and we need building blocks for that. So if that nutrition is in question, usually the mother's body will suffer before the fetus. So resources will be allocated towards fetus. Okay, time to give birth. Fancy name for birth is parturition. And as birth is approaching, we see changes in a woman's hormone levels. Her progesterone, which was one of those primary sex hormones, decreases. And normally that hormone's job is to inhibit uterine contractions. So now without that hormone, the uterus and the muscles of the uterus will start to spasm or contract, getting ready to deliver this baby. It also stimulates the creation of a different hormone called prostaglandins, and that will initiate the labor process as well. In step 3, the uterine tissue starts to release oxytocin from the pituitary gland. That oxytocin creates stronger and stronger uterine contractions, and this was our other major positive homeostatic mechanism of the year. We talked about blood clotting as one. This oxytocin, which is stimulated by contractions and stimulates more contractions, is the other. As those contractions occur, the cervix starts to open. It is a very, very small opening, but it starts to contract and eventually will reach about 10 centimeters in dilation. So as that fetal head starts pushing downwards, the positive feedback loop continues to allow stronger and stronger contractions, opening the cervix more and more, with greater and greater force each time. Eventually, when the cervix is stretched enough and with enough contractions, the fetus can be pushed out through the cervix and the birth canal and the vagina. So this is what we're seeing here. The cervix is normally very small and closed. Before a baby is born, it should shift so that it is head first because that is the hardest part to deliver. And if the head comes out first, then at least the baby can breathe. Feet first or breech can be really dangerous, so we might do a C-section then. So that cervix dilates as the oxytocin stimulates those contractions. Eventually, the baby will come out head first. And once the head and shoulders come out, the rest of the body comes out almost instantly. And then we still have to deliver the afterbirth. So the placenta and the umbilical cord must be delivered to clean out the uterus and finish the pregnancy once and for all.